Welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon, Dr. Joseph Mealy, and we're here talking about different procedures. We are going to talk about
male breast reduction.
Male breast reduction, gynecomastia.
Gynecomastia reduction. And these are massive ones.
Massive ones, okay.
And I've talked about them before, but these are the less common ones.
The less common ones.
People have lost huge amounts of weight. And not only do we have to worry about the size of the chest, but the amount of skin that's there.
Oh, okay. I like that. Let's go to picture number one, because now I'm very intrigued.
Okay.
All right, what about a good candidate for gynecomastia? Let's talk about that, because men don't usually say, I'm going to go get some plastic surgery and run right in. It takes a lot, right?
Yeah, it does. But I think once they make the decision, they do pull the trigger faster.
That's true. So, they do make that decision quicker,
but most,
for sure.
Most guys, it's not this kind of reduction where we're worried about extra skin. It's like a little nubbin behind the nipple and the areola, or the lower part of the chest is full. And in those cases, just removing the glandular tissue and combining it with a little bit of liposuction is enough. We're not having to make big incisions. Usually it's a small incision under the areola, maybe one in the armpit to let me do the liposuction. The ones I brought today are different.
All right, I'm intrigued. Let's go to picture number one then. Talk about it. All right, what do we have here?
This is a gentleman who had already had gynecomastia surgery, and I don't know if you can tell in the picture on the before picture, but his left nipple is completely indented.
Wow, so that's
too much was
inside the
removed
skin.
from behind.
Wow.
And yet the bottom was still full. So it's kind of the worst of both worlds, because he's got this deformity with the shirt off, but with shirt on, it's still making a bump.
Wow.
So he was very disappointed with that. So what I ended up doing was the kind of surgery you do after massive weight loss.
Oh, really?
And that's probably what he needed the first time.
Yeah.
And at least since he went through it once and knew what it looked like without the scar, now he was a little more receptive to having the scar. So what I've done is I've put a scar along the bottom, just like we do for female breast reduction. And then I used some of that soft tissue that was extra and made a flap and put it underneath his nipple areola to make things smooth. So it's like filling in the pothole.
Oh my gosh.
So we can rearrange things underneath where you don't see it.
So it came out, it made
So everything's flat, smooth, round like it used to be, and then it's tight. And then, most importantly, in clothes, it's flat.
It looks really good.
So he can wear whatever he wants and feel comfortable. Obviously, he's comfortable without. Because
his
sunburn was only his neck before. Now it's his whole body. And I got to tell you, you don't want big sunburns on new scars, because they can tan, get dark, and make it more noticeable. But
he
there was no
excited
stopping
to take that shirt off. Oh,
he was
no.
very happy.
He got his gynecomastia. He was on that beach the next day.
I think he might have been.
All right, let's talk about the second picture.
So this is a guy who also lost a lot of weight, but he's in incredible shape.
He is.
And he wants to show that.
Yes.
So what I've been able to do is get rid of that extra skin that's kind of fallen off the chest that's hanging underneath.
Yeah, see that there. In the before picture, he didn't have that much, though. It just kind of was sagging a little bit.
It's about an inch or so that you can pinch. So we've removed that, and in this case, just went underneath, removed a sort of a lens shape of skin, and closed it back in so we can get it tightened up.
I love that. And what about downtime for men? Gynecomastia is the same as women, and recovery time and all that?
Recovery time usually is less for men.
Is it really?
Because there's just less to worry about at the end.
Oh, okay,
with women, we still have that breast tissue. It still has some mass to it. It can move. With men, it's kind of flat. But usually, I don't want people working out hard the first week, because it may cause bleeding, may cause trouble with their incisions.
Don't raise that heart rate.
Exactly, especially with these types. So again, usually a couple weeks, I'll let people start getting back to it. And then by 6 weeks, they can pretty much do whatever they want.
All right, here we go. We're getting into the
So this guy, I have the little lower photo also. Because if I just showed the chest, it's not that impressive.
Yes.
But it gives you an idea of how much extra skin there is.
There was a lot of it. Now, did he do the gastric bypass or anything on this?
I think he worked out. I think he just got diet and exercise going and was able to lose a lot of weight, like over 100 pounds. So I've done a tummy tuck to get rid of the extra skin.
Whoa.
The belly button sort of left where it was, but you can now see it's a belly button instead of in the middle of a bunch of skin. And then that skin's all brought down. For the chest, I've had to remove skin also. So you can see those scars are relatively new, so they're easier to see.
Yes.
And then the nipples and such, often when the nipple is this low, I take it off like a skin graft.
Oh, really?
And bring it up onto the chest where it belongs. So
fantastic
for women, we don't do that very often because it gets rid of the sensation.
Yeah.
But men, they don't seem to really care.
So he had loose skin all over because he lost all that weight.
Yeah. And you can see the fold on the side of the chest.
Yeah.
It's above his nipple before, and afterwards it's down where it belongs.
And those scars will fade.
They do.
Probably better, easier on men too. And
most of my massive waist loss patients really are not worried about
No, they
scars.
are not. No,
they're really worried about,
yeah.
I mean, how do you put this in your pants? That extra skin, you can't get it in your pants. The chest, it just looks sloppy. We can make it tight.
And speaking of that, the last one here, can you, this is the final
Same thing
picture.
here. So on the breast, we did a reduction, did the skin grafting, moved everything up, reduced it. These scars are a little bit older, so they're more faded. And then a tummy tuck down below.
Very
it just
natural.
tightens everything up.
And can the skin on the chest be tightened? I mean,
I have to remove some.
Oh, you just have to
I don't
remove
have a
some.
skin tightening ray. I've
I'm
been
still
looking
waiting for that
20
ray.
years,
I don't know
and-
where it is.
Yeah.
All right, that's great. That's very natural, and I love that. Very natural results on it. All right, thank you so much, gynecomastia. There we go, and you did show us
Massive
some
gynecomastia.
intriguing
The more normal
photos.
ones are on the website.
Yeah, that's true. All right, for more information about Dr. Mealy, call 925-943-6353. Check him out on the web. We were just talking about that. You can see all these before and after pictures. drmealy.com, sanfranciscobreast.com, cron4.com. 4 things you need to know from Dr. Mealy. We'll be right back with lots more on Body Beautiful.